For last few months, I am getting phone calls from my junior colleagues who are just past MBBS and trying to get MD/MS seats from all over India. And the question was same that, sir, should I take dermatology? What are the pros and cons? So I thought to make a video on it. Let us discuss it in detail, and I thought to make a video that tells about how to choose a subject after MBBS. Let me introduce first, because the audience are you doctors. So I am Dr. Surajit Gorai from Kolkata. I am a consultant dermatologist at Apollo Gleneagles Hospital, one of the most reputed hospital in Eastern India. I did my MD, then DNB, secondary DNB. You can pass it after MB, just giving the exams, theory and practical. Then I got MNMS degree, that is also after DNB. If you pass in single chance, you can get it. Then I, being an academic person into research, so my papers were accepted in last 2 World Congress of Dermatology. World Congress of Dermatology is the biggest festival of dermatology in the world, and it happens once in 3 years. The first time it was in Vancouver when my paper got accepted. Then it was in Italy, Milan. I have published more than 12 research papers in different national and international journals. I gave lectures in more than 50 conferences and many pharma sponsored events in CMEs. So see, to choose a MD seat is not easy, because this is a lifetime decision. The first question is, should I do something after MBBS? I mean, should I choose MD and MS, only MD and MS after MBBS, or should I choose DNB? So that's a big question. That is a different video, I think. And before that also, we should have thought about, should we choose medical science after 10+2? That is also a different video, I think. I will definitely try to make some videos on that. What about medical life? How is the current situation in India to practice medicine, to practice dermatology, and what is the doctor's life actually? So I will try to make videos on that. After MBBS is the toughest time, because you have put lot of energies on study without any earning. You have put lot of energies on your probably coaching, and spend lot of money also. So it's been tough time, and you are not in the position to take a foolish decision, because now also I got phone calls from my friends who told me, Surajit, I have taken the gynecology and I never liked it. So this is a very tough time when you need to take a proper decision with a subject that will live with you for the rest of your life, that will feed you, that will give you pride, that will give you enjoyment, and you need to take a proper decision here. You can't be a loser in this decision, because once it is done, it is done. So first thing is, one pure statistics you have to understand. There is approximately 75,000 MBBS seats in India, and there is 25,000 seats for MD and MS. So there is a typical bottleneck. Whatever manner you try, you won't get 75,000 seats after MBBS. So this is a typical decision. You should try for MD, MS or not. One more thing is, after MD and MS, there is bond in almost all the states in India. So after your MD, MS, you have to serve bond for 3 years, or you have to give a huge penalty of money. That is not rational to me anyway, because it's not there in any other profession. And you are the brilliant brains of India, probably the best student of your state, maybe your at least your district, your school, but yet you are exploited to serve the bond. But that's a different matter, political matter. We are not going into that. You have to take it as it is there. So in my opinion, as in India, MD and DNB both are equivalent, there is no harm in taking DNB. Someone says that, someone said that a DNB education is not that good. It's not true, because in DNB also you will be trained in a medical college, or if you are not in a medical college, you will get trained in a nearby medical college. In many corporates and privates there are DNB, and those are really good institutes, because they are having all the equipments, they are having all the good doctors, they are having all the academic environment. So DNB is definitely good option for me, because you don't have to serve the bond. Probably till now, because long back I have passed, and probably till now there is no bond after DNB. So that's one option. And second thing is to decide the subjects that you don't want. Not putting any subjects down. In my time, I have decided not to do FSM, not to do anatomy, not to do physiology, not to do biochemistry, and not to do ophthalmology. So these are the subjects I have chosen not to do. And after that, if I get any subjects, I was open to do that, because after so many years of tough preparation, if you are very pinpoint in your aim, then it might not be logical, because if you don't get it, you will be upset for a few more months. You will study again, and after again probably 1 year, it will be a disappointing journey for you. So first decide what are the subjects you don't want to take. Then you will give a clarity what are the options left for you. And now you have to decide, or at least categorize the subject from 1 to 10. Like first I will take dermatology, second I will take radiology, third I will take orthopedics, fourth I will take pediatrics, in the manner. But before that, you need to categorically devise what you exactly love. You love a surgical subject to do surgeries, or you love to treat patients, or you love both. It may also happen. So don't blame you for loving both surgery and medicine. There are options. So after deciding that, probably you will be eliminating another 2-3 subjects. So if you don't like surgery, then few subjects are out, like general surgery out, orthopedics out. So then you can choose between the medical fields. And if you are liking medicine, if you are liking surgery only, then already many things out. But if you are liking both, you can get some options, like in dermatology you can get both. You can get dermatosurgery, you can get definitely dermatology itself, the clinical dermatology. If someone also liking pathology, in dermatology you can get it. Dermatopathology is there, and it is coming up in India, because with dermatopathology you can pinpoint many diseases that are important, and treatment is entirely different on the basis of pathology. So dermatology is pretty good combination for that. And then one thing you also have to keep in mind, that when you are passing MBBS, you are already 23-4 or maybe someone 5. After that, you have spent 1 or 2 years in preparation, so 26 maybe, and then 3 years for MD/MS. So then you are at your 30-29. So at this age, if you have to do specialization again with a competitive exam, then I think it is a bit tough. So one other 2 subjects that I have decided not to do was general medicine and general surgery, because not because I am not loving them, but I have decided for practical reason, because again to be a specialist I have to do another competitive, I have to clear another competitive exam. So when I was preparing, it was very clear for me that what are the subjects I am not opting for. I was also open to even choose community medicine, because the life is pretty good there. You don't have to do that much of vigorous practice. You can do general practice, you can be with all the medical research. So I would have loved to do if I didn't get dermatology, because and it was my 3rd or 4th, 5th choice probably. So another thing is, don't just go with the name, fame and money. You really need to know about the lifestyle of that subject. Like you have to be very clear about what you want in life. You want money and you want time. That is probably similar for everyone. But there are a lot of subjects, those are having very good practice, but you won't have time for yourself. So that also to be taken into consideration before starting your journey. When you are clear about it, then just talk to a doctor who is in that specialty to know the exact details about his lifestyle, his earnings. Maybe he not be so eager to tell them, but he will get a rough idea about it. That is very important. Otherwise, probably you have done something and you are regretting later. So that should not happen in any situation. So to sum up, in my opinion, first remove few subjects that you don't want to take, then make a chronology of or order of subjects that you want to take in the manner of 1 to 10, and then you decide surgical subject or medical branch or a combination of it. So then you will be able to rule out few options, and then you also can think about, do you like practice? Practice life is not that easy, because 3 to 4 years will need to establish your practice, to have a basic income. You have to put lot of energy, lot of money, and today's world you have to be really present in the virtual medias to be known by others, and you need to have a proper location for your chamber. You need to get associated with sometimes brand, and even if after having all those sincere efforts for many years, you may not get the desired result. So practice may be very lucrative, but may not be good option, because I have seen many doctors who are practicing for years together, and they start in the morning and they end in the afternoon or in the night, or they start in the afternoon and end in midnight. So that life I didn't wanted to, because I was thinking about an amalgamation of life where I'll get clinical subject. I will treat patient. I love to interact with patients, and I will get surgeries, because in my UG days I loved surgeries a lot. I did lot of surgeries at that time. So even after passing MBBS also. So I wanted a combination of things, and I did my house stepship, I did my JRship, you can say, in dermatology, and that was only because of I will get time to prepare myself for PG. But then I loved it because I had to see 100 patients per day. So I really loved it. The visual appeal of the subject was very interesting for me. You just see the patient and diagnose, but it was very easy at that time. Gradually, when I got mastered myself with the skills, I found that it is really difficult, really tough, because there are a lot of branches, lot of complications, and even a single subject like psoriasis itself is a huge discussion. So now I am trying to get my niche, and practicing niche part only with few disease like psoriasis, vitiligo, and cosmetic dermatology, where I got surgical aspect also. So I got both of the things, like surgery and medicine together. So in dermatology, this is the beauty. And about earning, definitely not a very big option, because just after passing MD, you won't get any attachment, because full-time 24 hours RMO system is not there in dermatology. You get it after medicine or after surgery. So this is very disappointing for first few years. You can get residency program, SRship, in few institute. It's a good option if you want to be in the academics for lifelong, or you can also sharpen your knowledge. That's a good option actually. Then gradually, if you can build your practice, it's good. Yeah, definitely it's good. You have time to do research. You have you can give time to yourself. You can do exercise. You can give time to your family. That's also important, because I have decided not to practice for the whole day, but for first few years it was difficult because you have to really go to outskirts, you have to give a lot of time there, a lot of energy there, but gradually after 3-4 years you will get a stability. So in dermatology, this is the perspective. One of my friend did radiology and later repent because he didn't get a chance to treat the patient. He diagnosed, he did everything, but didn't get the chance to treat the patient. So that should also not be there in your mind. You decide first if you want to treat the patient. In radiology it is difficult, but now there is interventional radiology where you can treat the patient also. So discuss whatever you want with your seniors or with your desired subject master, so that you get a clear cut idea about it. Before getting a clear cut idea, don't indulge yourself having a subject that you don't like. That my junior told me, Dada, I didn't get general medicine, I opted out. I told, what you have got then? He told ophthalmology. I told, man, I know you. You liked playing cricket. You liked fun. So why did you opted out from ophthalmology? He told, no, I wanted medicine. I told him that you don't have clear cut idea about ophthalmology. That's why he left it. So don't ignore any subject. In any subject, if you can do good, the universe is yours. You can do anything with that subject. So you decide what you want. There are a lot of options, 23 subjects. Don't take it as a curse. Take it as a blessing that you have the option to choose. But choose wisely, and please comment below what are the videos you want regarding post MBBS life, regarding choosing your subject. If you have any comment, any modern suggestion, I will be happy to accept that. We will be happy to discuss with you. I want younger guys to be with me to do more videos on that topic, because that will help lot of students. And I want to make videos for the just 10+2 guys also, because I have seen my friends who after taking MBBS is frustrated because of not having that academic zeal in the subject. So probably that guy would have been very happy with physics, but sadly he landed up to MBBS. So I will be happy to do more videos on that. It's an invitation to you guys, those who are passed recently after MBBS. We can make videos together. We can teach and guide lot of people, lot of students there who are clueless now. Thank you so much for patient hearing, and I'll be happy to hear from you in the comment section.